Still finishing day 5 of this testimony. But Dr. Biswas and Corey Mello are two people who will never want to ever be a witness for the prosecution again, because these ADAs let them be served up like fucking chum in the water, and it was terrible. Before I get to them, I want to talk about the psychiatrist who treated Lindsay, and this was for the time she was in the hospital, and then continued to monitor for weeks afterward. Her name was Dr. Sejal Shah, and I think she turned out to be a much better witness for the defense, because it was clear that, again, she's an advocate for her patient, and she did not, you could tell she did not want to follow the path that the prosecution was trying to carve out for her. Dr. Shaw was originally called in to do a psych eval with Lindsay because Lindsay wanted to change her healthcare proxy. So Patrick was responsible for her healthcare decisions. She wanted to have that legally changed to her parents. The lawyers were brought in, the social worker was brought in, and of course they bring in Dr. Shaw to do the psych eval. She's looking for 4 things. She wants to make sure that Lindsay is the one that's voicing her choice, meaning that it is consistent over time. This is exactly what she wants and nobody else's wishes. That she comprehends the situation, that she appreciates the risk and benefits, and that she has the reason and rationalization for this decision. Dr. Shaw said that she met with Lindsay the first time on the 29th and then waited overnight and came back again to make sure Lindsay still felt the same way. So it was that whole consistent overtime thing that she was looking for. Lindsay was able to tell her that her parents are very supportive of her. She has a very good relationship with her parents. They live close to her. They would always have her best interest at heart, and they would go out of their way to make sure she was supported. Dr. Shaw said that Lindsay described herself as being confused on the first day they met, that maybe there was a little bit of delirium and also some visual hallucinations that she'd been suffering from, and that Dr. Shaw thought she might have a mild brain injury. But then the prosecution said, yeah, but nothing came back on the CT scan. And Dr. Shaw said, you can have a normal CAT scan and still have a brain injury. And that's where I think the wheels started to come off the wagon for the prosecution. She realized she had a witness that wasn't exactly going to be as compliant as she'd hoped. Then confirmed with Dr. Shaw that there was no bleeding on the brain, there was no skull fracture, there were no physical injuries to Lindsay's head that she could see, and that they asked her why she went ahead and made this decision. In the greater scheme of all the things that Lindsay was going through, a healthcare proxy is a pretty low-risk decision. Dr. Shaw said she found Lindsay to be organized, thoughtful, calm, cooperative. She was forward thinking. But she did say that she felt that Lindsay was an ongoing safety risk. This is why she continued to monitor her even weeks later. She was about to be transferred to Spalding, which I guess is a therapy hospital. And so she did feel that Lindsay might be an ongoing safety risk. She still may be having suicidal ideations, that the medication she was on needed to be reviewed and make sure it was appropriate before she could be transferred. On cross-examination, the very first question that Reddington asks her was, in all of your consultations with Lindsay and all of the times you asked her about how she was feeling and the medication she was on and what she was going through mentally and emotionally, did you find her to be an honest patient? The ADA immediately jumps up and says, objection. But the judge says, you know what, go ahead and answer that question. And she says yes. She did not believe that Lindsay was not completely forthcoming with her. Very open in their dialogue, was honest about what she was feeling and what she was going through. She was asked, do you believe that Lindsay was ever trying to exaggerate her symptoms for legal reasons? No. And that she continued to monitor her weeks after. He asked about postpartum issues, and he asked her, can people plan and act on plans in the middle of psychosis? And she says, yes. Shaw indicated that she believed that Lindsay Clancy was very ill. She was asked if she was familiar with bipolar, which she is, and she explained, I'm going to just race through this really quick, but she says that there's mania or hypomania, irritability, impulsiveness, out of control behavior, racing thoughts, moving too quickly, talking too quickly. He asked her, could a form of hypomania be somebody who is exercising excessively. They're awake all night. They're cleaning their home. They're selling garage items. You guys thought I was crazy when I said she was going and cleaning out her garage. This is what he's saying is part of it, and it may stem from undiagnosed bipolar. And she said, yes, all of those things could be symptoms of bipolar. Then they went through all of her medication. So it ended with kind of a bang. This doctor ended up being very, very good witness in Lindsay's favor. There are two that ended up getting the shit kicked out of them. And this one woman, this Dr. Gilliam Biswas, she really, honestly, I mean, let's just cut right to the chase. The only fucking reason she was there was because this ADA needed her to come in and basically say, like, one sentence, that Lindsay, shortly after becoming conscious, immediately asked for a lawyer. Like, that's the whole bullshit rumor that's floating out around there, that she immediately asked for a lawyer. If she didn't do anything wrong, why does she need a lawyer? That's not entirely the situation. And so I think Biswas tries to clean this up a little bit. She says, well, yes, we had the whiteboard, and she was asking other questions. She was asking questions like, can I have visitors? Is my body broken? Where is my family? Are my legs straight? Like, she was asking these types of questions. And then in there, she also said, do I have an attorney? Now, Biswas didn't know really at the time that what she was asking for was that she wanted to change that proxy agreement. Biswas only met with her for 20 minutes. From that 20 minutes, she was expected to evaluate and recommend treatment for her. On cross-examination, she's eaten up by Reddington. And it's not her fault. I don't think they prepared her for it. And I could see that there were a number of times where he was pushing her really hard on questions. And you could see she's like looking at the prosecution's table, like she's waiting for somebody to fucking object, and nobody's coming to save her. Reddington got her to basically admit that she didn't really fully read the records, or really didn't see all the depth in the records. So really wasn't aware of all the postpartum documentation. She wasn't aware of the insomnia. I mean, she knew about it, but wasn't sure that at one point Lindsay said she was awake for 48 hours straight, that she was hearing command hallucinations, that she had suicidal ideations. Again, she was called in to make a snap decision. And all the prosecution wanted her to do was basically say, I walked in the room and Lindsay asked for an attorney. This fucking blew up on them in a big way. Dr. Biswas, unfortunately, has to admit she really didn't take any of this into consideration for this. She didn't do a deep dive, and so she just made a very preliminary psych evaluation. Redirect, the prosecution says, but Lindsay wrote on the whiteboard that she was asking for an attorney, correct? And Biswas tried to clean this up a little bit. She's like, well, I mean, she was asking a lot of questions, and she was very confused, and she was very sick, and she was trying, and it was so fucking unprofessional. They were just basically like, that's all, thank you. And just, this poor woman got eaten alive. Now, come back to the next video, because I still have to talk about this Corey Mello person who also got his ass handed to him. And I almost felt sorry for the guy. Keep coming back. I've still got more witnesses.